औज़ुबिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम। शुरू करने से पहले एक अच्छी बात, एक्शन इज़ द फंडामेंटल एंड फाउंडेशनल की टू ऑल सक्सेस। सो आज से पढ़ाई शुरू करें, टेक एक्शन। FCPS थ्योरी को पास करने के लिए अपने वक्त में जब मैं एग्ज़ाम दे रहा था तो मैंने पिछले 10 साल के IMM, DCH, FCPS, MCPS इन सब के पेपर्स पढ़े जो कि आजकल नहीं मिलते, और इन सब पेपर्स के अंदर से मैंने कुछ टॉपिक शॉर्टलिस्ट किए। सो इंशाल्लाह अभी से मैं उन टॉपिक को अल्फ़ाबेटिकल ऑर्डर के अंदर वन बाय वन एक इजी वे में आपको पढ़ाने की कोशिश करूँगा जिससे आपको समझ आ सके। उस सिलसिले का आज का पहला टॉपिक है 5 अल्फ़ा रिडक्टेज डेफिशिएंसी। 5 alpha reductase in deficiency in this is the disorder in which testosterone cannot be converted into its active form, that is 5-hydrotestosterone. The symptoms, first of all, the genetics, it can be 46XY disorder of sexual differentiation. It is a very rare disorder and transmitted as autosomal recessive form. The child can present at birth, or it can present later on. At birth it can present with atypical genitalia. The child may be having normal female external genitalia, but there will be masculinization and phallus growth at puberty, or the child will born as a normal male with a small size phallus, or there will be hypospadias of varying degrees. So this is an autosomal recessive. So the history will tell you about, there will be the history of consanguinity in this, and you have to ask for this, and there will be some other family member with the problem. So the examination, general lobe vitals will be depending upon the cause, so there will not any specific clues to this diagnosis. However, in a systemic and a local examination, you can see the genitalia that will not be particular for any gender. Like in male, the genitalia will be undervirilized, or in female this will be the enlarged clitoris, which is mistaken as phallus, while in adolescence there will be gynecomastia. So the differential diagnosis, you have to consider the congenital adrenal hyperplasia due to 17 beta hydroxysteroid dehydrogenase 3 deficiency. It presents with the same, but it has a greater impairment of virilization, and there will be increased serum aldosterone estradiol. And another is, you must consider is androgen receptor functional defects. This also presents with ambiguous genitalia, and but it presents with gynecomastia at the time of puberty. In contrast to 5 alpha reductase, it presents with masculinization. So investigation, the diagnostic investigation or gender or sex assessment is very important. So you have to do the chromosomal analysis to see what is the genetic gender of the child, phenotypic examination, and internal genitalia by the ultrasound of the pelvis. So molecular genetic analysis is the gold standard, and SRD5A2 is a gene which is involved. Ultrasound of pelvis, in case it's a male who is reared as a female, there will be a vagina which is blindly ending pouch, and internal genital organs will be male. The testosterone level will be normal. However, the ratio of testosterone to dihydrotestosterone is increased, and it can be greater than 20. Basally and post-HCG stimulation test is used to perform. LH levels are normal in 50% of the patients or slightly elevated. However, FSH is elevated. Treatment is, no specific treatment. However, you have to assign the gender role. Most of the kids are assigned the male gender at birth. However, those with the female genitalia are raised as females. Sometimes the role change to the male after puberty, जैसे आप लोगों ने सुना होगा कि औरत मर्द बन गई या मर्द औरत बन गया. So these are this type of disorders. So the main is, you have to surgical options after considering what the child, or what are the psychosocial thoughts of the uh, particular patients. If the child wants to remain female, then you have to do the gonadectomy, and this should be done before puberty. If there's a clitoromegaly, it is surgically corrected. If there's a decrease in the depth of vagina, which can be increased, artificial vagina can be placed. This practice is in debate. However, the children who are raised as male or wishes to change role to male, it is a very complex decision. Surgical correction of hypospadias and cryptorchidism by experienced surgeon. Testosterone supplementation, but long-term safety is not established. The question of fertility is they have the low sperm counts. They can occasionally achieve fertility with intrauterine insemination. In a female with 46 XX are also described. They are a normal female, however, they have late menarche. So you have to consult the endocrinologist. Some kids are not diagnosed early and they are raised as female and then they can change their social gender role after puberty. Some are comfortable as females. Surgical management is done only after careful psychosocial assessment. So this is a social emergency when the child is born. Everyone is asking क्या पैदा हुआ है, कौन पैदा हुआ है, लड़का है लड़की. So this is a social emergency and a very important topic. सो थैंक यू वेरी मच फॉर योर लिसनिंग. और किसी किस्म का क्वेश्चन हो, अभी मैंने ये थ्योरी पढ़ने का आपको सिखाने का तरीका शुरू किया है. इसके सिलसिले में अगर कुछ सजेशन हो तो डू लेट मी नो. मे अल्लाह बी आवर हेल्पर, प्रोटेक्टर एंड गाइड. अल्लाह हाफिज़.